Welcome to Let's Clear the Air, a podcast sponsored by the Allergy, Asthma, and Sinus Center, dedicated to educating listeners about allergies, asthma, and immunology.
Well, welcome back to Let's Clear the Air, all things allergy, asthma, and immunology. I'm your host, Liz Edwards, and today I am with Dr. Mike Norvell. We are in our Franklin location, and we're looking outside, and it already looks like spring is upon us as far as the allergies that are about to hit.
Well, it's going to be here before you know it. Typically in this area, we see the tree pollen coming out first, and that usually is sometime typically late February, even though last year, just due to the climate, it was a little bit early. But February is when we start trying to gear people up and just kind of make sure that they're prepared and ready for when that pollen hits.
If I do suffer from spring allergies, what would you want me to start doing right now to get ahead of the symptoms? Should I start with my nose sprays or any other over-the-counter?
The biggest thing that we hear in this area, and especially lately, is we're seeing people moving in just really in greater numbers to Middle Tennessee. And a lot of people will tell us, I've always had problems with my allergies, but I've been able to kind of manage it with just over-the-counter medications if I'm going outside. But then when they get here, they just find that they're overwhelmed and that what they usually find is effective may not be enough. And so when that happens, what we encourage people to do is first and foremost, get tested so that you can actually make sure that what you think is going on is actually what's going on. And it probably is, but that's not always the case. And then if you're new to the area, you may find that medication that used to work just isn't enough. The problem is that medications only treat the symptoms. They do nothing about the fact that when you have allergies, your white blood cells are making these allergic antibodies to the airborne proteins like the tree pollen that we're seeing in the spring. So if that's the case and you find that the medicine's not helping, you may really want to consider looking at something that's more in line with being curative, such as immunotherapy, or that's what we call it, but it's most commonly known as allergy shots.
Do you find that this time of year, your patients coming in, it's a little hard to discern what we're all suffering from because you have flu and there's still COVID going around and bronchitis and all the crud? And do you find it hard for people to hone in and decide when they need the help?
Sometimes that can be the case. I always just try to err on the side of caution and tell people, hey, if you're having flare-ups with your nasal symptoms, especially with your breathing or your sinuses, something along those lines, give us a call so that we can get you in, evaluate you, see if this is just your routine allergy issues that are just experiencing kind of a seasonal uptick, or if you may have something going on more in line with, like you mentioned, a viral illness causing bronchitis, something like, nowadays we deal with COVID, and that can be a big issue for certain populations. And then even influenza, especially for our patients with asthma, we want to make sure that they're covered and that they address that on the early side, because it can be more impactful, especially for our patients that have chronic breathing disorders.
Let's go back to the allergy testing for a moment. What does that look like? How long of an office visit does that generally take?
Well, we can tailor that to the patient's needs from the standpoint of a lot of patients like coming in, and as long as they're not on any antihistamines or certain other medications, we can get that testing done rather quickly, whether it be 15 to 30 minutes just for the testing. You have to factor in other elements of the office visit as well, but the testing in and of itself is only about 15 to 30 minutes. And then for those patients that aren't able to come off their medicines, they're just too burdened by the symptoms, we do have the fallback of being able to utilize some blood tests as well. So sometimes it takes them a while to get in because they've heard awful myths or stories that allergy testing is so horrible. We do have other alternatives, but even the skin testing in and of itself, we actually have the ability to do that in children and even babies for elements such as food testing and so forth. And it's really not so bad. We've actually come a pretty long way.
And it's really just a little scratch on the skin.
Yeah. In some people that are needle phobes, I totally get it. I have some of those in my own family. They're actually little plastic applicators, almost, I tell the patients they're almost like toothpicks. And it just leaves a little drop of liquid on the skin, and we leave it there for 15 minutes and then come in and clean it off and read it. And we can tell them whether it's positive or negative.
That's really neat. I mean, like, you literally find out on the spot what is triggering you.
Yeah, it's really convenient to be able to do that in one setting and not have to have multiple visits and be able to come in with a problem and when you leave, you have a high likelihood of actually knowing what's going on and being able to come up with an effective plan for how you're going to treat that.
For the patients that you decide need to move forward with immunotherapy or allergy shots, can you talk about how the serum is made for each patient and what that consists of?
The only thing that you receive as far as allergy shots go are just those proteins that you're allergic to. So it's not like, that's the other thing, is that sometimes people come in and think that they're going to be able to get tested and start on allergy shots that day. And that's not actually the case. We actually have to get your own individualized serum made up, because everybody's different. There are some people that come in and they're just allergic to dust mites, or there's some people that come in and they're just allergic to their cats. I had one of those this morning, and the patient was only allergic to cats and dogs. And then there are people that are allergic to everything, pollen and animals and dust and mold. And so we cover just those things that the patient is actually allergic for. Also, it's not including other elements such as steroids or other medications in with your allergy shots. There are some old timers that come in and they grew up going to the doctor and they thought that what an allergy shot was actually a steroid shot.
Right.
Because they'd go in, they'd come in and they'd say, yeah, I'm coming up on the spring and I know I'm going to probably have to go in and get my allergy shot. And that's what the doctors called it for a number of decades. And all that they were actually referring to was a steroid injection, which can be, in the right patient, an effective Band-Aid almost, because it's only going to be temporary.
Right.
What we like to focus on is more permanent treatment.
So when I start the allergy shots, when can I expect to feel relief? Not necessarily immediately, but what would you say? Like, if I were to start them now, would I feel relief this spring?
Yeah, that's a good question. What I would say, and I prepare patients for this. I mean, I see patients with allergy issues year-round, 12 months out of the year. And a frequent question that I get asked is, when's the best time to start on allergy shots? The right answer to that is anytime. However, if you want to pick really the perfect time, I tell patients October. The reason for that is because in October, you're getting ready to come out of the fall, go into the winter, so you're going to have no pollen and no mold in the air for the most part. And you're able to get started and build up to that maintenance, to that top dose, so that you're most protected on your allergy shots before the spring hits. Now that we're getting ready to enter into that spring season, starting on allergy shots, you're probably not going to see noticeable relief until summer. And that's honestly going to be not really probably from us. It's probably going to be because we usually see a dip in that tree and the grass pollen naturally about July. But that improvement tends to continue because those people that are allergic to ragweed, for example, which is our big fall pollen, if they start allergy shots in the spring, they would be protected. They would be at a protected level come the fall. So usually if you're starting in the fall, say February or March, you're probably not going to see significant relief just from your shots until the summer. Now, we do have medications and other things that we can educate the patients on to help them currently get through to that time. But it's always good to prepare them and let them know and not have any false expectations.
And it's a long-term treatment in the sense that, I mean, it takes a few years to come out on the other side, I guess, to get to maintenance level. But it's worthwhile. You're changing your immune system.
Well, I wouldn't say changing. I'd say modifying.
Okay.
Just in terms of it's not permanent. That's what there are people that have a lot of apprehension nowadays for different reasons, and we're not changing anybody's immune system. The way that I describe it, it's more like a dimmer switch. So
Interesting.
What we're able to do is that by giving you small increasing doses of just those proteins that you're allergic to, we're able to turn the volume down over a period of time. And it usually takes about 6 months or so to build up to maintenance. And then there are guidelines that lay all of this out on how you do it. Just like there's guidelines for treating patients with high blood pressure and treating patients with diabetes. There's actually guidelines for treating patients with allergy injections. And that's what we follow here at the Allergy, Asthma, Sinus Center, is just those medical guidelines that are published and established so patients can come in and know that they're being treated with well-founded, established therapies that are accepted around the country, and not just around the country, but around the world.
This is very encouraging. And for those who are listening, if you are suspecting you have symptoms, we would love to see you in our offices. You can look us up at allergyasc.com or give us a call. And we would love to get you in and get started. Dr. Norvell, thank you so much for being with us today.
You bet. Thank you for your time.
We hope you've enjoyed this episode of Let's Clear the Air. Please consider following this podcast, and remember, if you want helpful and accurate information about allergies and asthma, our allergy experts are here to clear the air.